Welcome back to Resolution Solutions on KDKA TV. I'm John Cline. Today, 6 businesses on the show. Right now, let's welcome Dr. Angela Hollis from MedExpress. Welcome to the show.
Thank you.
What is MedExpress? It seems like they're on every other corner in Pittsburgh, and if you've never been, maybe you're thinking, what is that?
Yeah, so, and we are everywhere, it seems. MedExpress is kind of a full-service urgent care center. We cater to the communities that we're in. We're conveniently located. Our hours are convenient, too. We're open 7 days a week, so it's really a great resource for people in the community.
And did something happen a couple of years ago where MedExpress went from 5 locations to 1 million locations in Pittsburgh? Yeah. You guys are everywhere.
We are. We have just been growing like crazy, which is very reassuring. I'm very proud of the company that I work for. We're in several states now. We're out in Arkansas. We're in Florida. We're getting ready to expand into Massachusetts, Oklahoma, all kinds of different areas. So it's really exciting. We have a lot to look forward to.
So basically, it's like going to a doctor's office without going to your normal doctor if you can't get hold of that person or you can't get an appointment.
Right. So that's kind of what urgent care is. We are almost kind of a middleman. We treat things that aren't quite serious enough to go to the emergency department. So certainly if you have, a heart attack or something like that, you're not going to want to come to urgent care. We don't treat things like hypertension, diabetes. Those are best served by your primary care doctor. We do the middle stuff. We suture lacerations. We treat sprains, strains. We treat strep throat. We can treat bladder infections, that type of thing. All those things that are time sensitive that you need to take care of in the next couple days, maybe you can't get into your family doctor for some reason.
Or maybe you don't want to go to the emergency room and you can go to a MedExpress. You guys are open not 24 hours, but you're open some pretty extended hours.
We're open 12 hours a day, 8 in the morning to 8 at night, which is convenient. You can. I brought my own daughter in before school started in the morning. You're making dinner and you cut your finger. Well, now you can come to MedExpress because we're still open till 8 o'clock to take care of that.
I've been to the one on Green Tree Road many a times over the past, probably 10 years. But it's something where maybe it's a guy thing where you're stubborn, where you feel like, for a couple of days, and it's like, all right. My wife's like, please just go to MedExpress.
Absolutely.
And then because you're not going to your primary care physician because you can't get an appointment, and it's so convenient. And I think the longest I've ever waited is 5 minutes, maybe. Yeah. It's quick.
We really do have a goal of trying to get people in and out within 45 minutes to an hour. That's kind of our door-to-door time. And we're pretty good with sticking with that.
And I'll give you credit. You don't have that evil place where you sit in the lobby waiting, and then you're called back to another room and you wait, and then you wait, and then it is very quick. And is that what makes you different? Yeah,
definitely. I mean, that makes us different. We have a very high standard for our medical care. We decorate our centers nightly. They're nicely. They're very nice to walk into. I've actually had people. It's funny. I have people ask me what color paint we use on the wall because
it's green.
It is. It's October mist or something like that.
Yes. I noticed.
But it's nice because when you walk into a MedExpress, they all look pretty much the same. And we handle things pretty much the same everywhere. So if you've been to one, you know what the next one is going to be like. So.
And you know what you'll get, and the people are friendly. What is your relationship at MedExpress with other hospitals and doctors' offices in the greater Pittsburgh area, or if you're traveling?
Right. So we definitely want to coordinate. We're not there to take anyone's place. You definitely want to, like I said before, if you want your diabetes treated, you want your high blood pressure treated, you want your pap smears done, you need that primary care. That is a definite, building block of our healthcare system. The emergency department, definitely emergencies only. But we just kind of put together that puzzle, and we're just a piece of that puzzle.
How do you work with other big organizations, with insurance companies, and are most of them involved with MedExpress, or is everybody's going to be totally different?
Yeah, so we do accept most insurances. We also work with several of the employers in the area too. We offer a large number of occupational health type services. We can do DOT physicals, we can do drug screens, we can do workman's comp evaluations, that type of thing. So,
how does MedExpress help patients manage their health all year? As we're coming into a brand new year, everybody's concerned. It seems like I'm wearing my Fitbit today.
Yes.
Everybody is concerned about health, and it's very front and center right now. How can MedExpress help?
So you wouldn't think with being urgent care, what can MedExpress do for health and wellness? And, we do things like flu shots. The flu season has been bad this year, but we're still looking at about 6 more weeks of flu season. So you can still get your flu shot. A lot of insurance companies and employers are recommending wellness exams, which is something we do as well. We also, one of the things that a lot of people don't know about, we offer smoking cessation counseling. So you can come in and talk to a provider and talk about ways and methods to help you quit smoking.
Has the flu season peaked, you think? Or I know you said there's a potential for 6 more weeks. But
yeah, for now, I think it has. Our numbers have definitely gone down. If anybody's been to any of our centers recently, it was standing room only in some cases, but we're definitely seeing that going down now.
How much does it cost to visit a MedExpress?
Yeah, so that depends on insurance. In most cases, everybody's plan is a little bit different, but we also, for people who don't have insurance, we have some affordable payment options for those patients as well.
So there are a lot of different options. So don't be afraid thinking I don't have money and I feel like bleh.
Yeah,
you can still go.
There's a lot of value that you can get at MedExpress.
If I walk in and if I need a flu shot, is it? I think one of the key things, you don't need appointments at MedExpress. Is that right? First come, first serve?
Exactly. Okay. So you walk in, come whenever it's convenient for you.
I am convinced flu shots don't work, but I know other people do. So, professional advice? Everybody's different on it?
I get one every year.
Okay.
I make my kids get one every
year.
year.
Have you ever gotten the flu?
I have, but I will tell you when I had I know, but listen, when I had the flu that year, I had a very mild case of it.
Okay,
so,
and they say that's one of the things that if you do get it, it won't last as long. What message would you like to send to everybody watching this morning about MedExpress?
Yeah, I just think that MedExpress is a great resource for the community, offering quick, convenient health care for multiple people, and we are everywhere. So, just come on in and see us.
Are all of the MedExpresses networked? So if you are on vacation in Myrtle Beach and you can go into a MedExpress there, would they have your files on file?
To some extent, we have a little bit of difference in as far as between state. But I will tell you, we've had, at least within the state, if somebody goes to the one, maybe they're in Washington, PA, but they live in Cranberry, I can see what happened to them down in Washington that day when they were seen.
And how about doctors in MedExpress? Are they exclusive to one location, or do they move around if somebody's comfortable and you build a relationship with a doctor?
Right, and so we do have a lot of our centers. We try to keep the same doctors and providers there all the time. We have physicians and then our mid-level providers that work there, and we try to keep them in the same center. And I certainly have several patient families that I've seen multiple times that know me whenever they come in.
And I'm assuming that's comforting too, because there's a bond between a doctor and a patient.
Absolutely, absolutely.
If you'd like to know more about MedExpress, you can call Dr. Hollis or log on to the website medexpress.com. Coming up next, Dr. Anthony DeCesaro from Whitehall Health Center. That's on the way when Resolution Solutions continues.